Good morning. Today we are going to speak regarding very important injuries in child. Those are elbow injury in children. Generally there are two most common types of elbow injury. One is a pulled elbow, or second is a distal humerus, that is distal arm fracture, which we say as supracondylar humerus fracture. So coming to pulled elbow is a benign kind of injury where there is a subluxation or dislocation, or the proximal part of the radius head which gets dislodged from its position, and many a times we find that it spontaneously relocates. So the child will be having tremendous amount of pain when it dislocates, but when it spontaneously relocates there will be absolutely no pain. So you will find that child is crying, after some time child is absolutely fine and normal movement of the elbow. So this kind of injury we say as pulled elbow, and it is usually benign. But sometimes what happens is this spontaneously dislocated radial head is failed to relocate, and that time you need to rush to your doctor where he will do a maneuver and he will relocate the elbow. So this kind of injury is, the mechanism is, while holding the hand suddenly child slips and there is a hyperextension, that is hyperextension of the elbow, which causes slippage of the radial head. The second most common type of fracture in child is a supracondylar humerus fracture, and there is a various grading according to Gartland, which has given A, B, C, D according to the severity. So if you suspect your child has got a supracondylar humerus fracture, there will be local pain, there will be swelling, child will be refusing to move his arm. When you get this kind of symptoms, please don't panic. So first and foremost, what you have to do is you have to do a immobilization of the affected elbow. So how to do a immobilization? In neighborhood is just tie a cloth around the neck, and that should stabilize the elbow. Suppose you find a deformity in the elbow, that means there is a displaced supracondylar kind of fracture, that is a severe grade like 3 and 4. Then don't try to immobilize. In the process which we have shown is like a flexing of the elbow. Just hold the arm and just call for help, and bring your child to the nearest hospital where the consultant physician or the emergency doctor will take a X-ray, and we will grade the fracture. So the most common injury, the supracondylar humerus fracture, 90% of time we don't require any kind of surgery, only a plaster suffices, generally in grade 1 or sometimes in grade 2 also. But if you find grade 3 or grade 4, usually it requires a close reduction and a pinning, which is a simple surgery, but it is a very important surgery. Generally, in most severe form of supracondylar humerus fracture like type 4, we generally find there is a absent pulses. So in that case, we require a super specialty team to manage those kind of fractures. So my advice to all parents will be, if you suspect a fracture in any of the child, immobilize that part and immediately go to a nearest hospital where the experience of pediatric orthopedic surgeon is there and who can take care of your child. We in Bhagirathi Neotia Women and Child Care Center, Newtown, provide a 24 hours urgent pediatric trauma care to all the child. You can come here and avail our facilities. Thank you.